The emergence of resistant bacteria to human antibiotics because of the use in food animal, the data is really very thin on proving that. There is some association that has been released by CDC that they feel like perhaps that some of the drugs in human medicine are less effective due to some similar type products being used in food animal medicine. However, in my mind, they fail to take into account the misuse of those particular human drugs in human medicine. But not being critical, I still think that there has been very little concrete evidence that at least the drugs that we've used in the past 5 years have had any effect on the resistance of bacteria to the modern human antibiotics. What we use now primarily to prevent disease in birds, and we're mostly concerned about diseases in the intestinal tract, we use antibiotics that have very little or to no use in human medicine. They're very large molecules. They're not absorbed into the intestinal tract. They work just inside the bird, and they are not. They never get into the meat of the bird, so therefore they could not have any sort of action carried to people in the market. Still, that is a debatable topic, and there's still a lot of research being done on it. Unfortunately, the public pressure to stop the use of antibiotics may preclude us from doing much of that research because the loss of sales of antibiotics is going to stop the funding from being able to do those kind of studies. Well, the development of superbugs from the use of antibiotics in food animal, there's no sound scientific data on that. Most people have an opinion and an idea that perhaps superbugs might emerge if we use no antibiotics ever in any food animal. Maybe if we didn't use antibiotics at all, because we find bacteria in frozen tundra that's 10,000 years old that is resistant to some antibiotics. So resistance and emergence of superbugs and those kind of pathogens on the bacteria side is a very complex factor. And it's actually, there are people that know a lot more about that than I do. But in my opinion, what we do and the way we judiciously use antibiotics in food animals, at least in poultry, is probably not the major factor in forming any sort of superbug in human medicine.